Most prominent universities in Ontario have now made vaccinations mandatory. Are you recommending that universities here take their own steps in that regard if they see fit? Or do you think that they should be staying within the provincial guidance that you said last week that you're working to refine?
So I wouldn't say most universities in Ontario, at least not from what I've heard. However, we, as I mentioned yesterday and last week, these are questions that we are addressing with our provincial committee, working together with the post-secondary institutions in the province. They're very important questions. We have always had a collaborative approach. We have the basic guidance that we put out, and we are refining it as we learn more going through these last few months. These are active discussions right now. What is the role of masking? What is the role of immunization? And we'll have more to say about that next week.
Do you have a follow-up, Srishti?
Yes, please. The original guidance from July 5th for post-secondary schools predicted that cases would be declining by September. Was that projection premature? Did it not take into account the possibilities of variants?
Of course, it took into account everything that we knew at that time. We say that we're going to be continuously monitoring, changing, adapting as we learn more about this virus. And that's really what we are doing. That's one of the reasons why we've put in these measures today, which are also a change from what we thought would be the approach earlier on in June. So, these are, as I said, part of the constant connections and discussions, looking at the data, looking at the pros and cons of different approaches, and understanding the real situation that we're in right now. But I will say we are in a different place, and that is clear, and it remains clear. That we are no longer seeing the same types of impacts across society that we were seeing prior to having vaccination. So it is not the same questions that we're asking or answering right now. Immunization rates are high. We're seeing transmission in unvaccinated people primarily, overwhelmingly. 96% or 93% of our cases are people who are not fully immunized. So that's the difference that we're in right now. And yes, when we have a highly transmissible variant, it means that it can move quickly through unvaccinated or undervaccinated people. So the way we address that is not the same as where we were just a few months ago.